you doing here? How do I look as a provider? How about this side? Stick around because we are going to talk about a technique that makes it so easy to ask your provider questions and get straight answers and not be that girl that is always questioning her provider or questioning the doctor because the doctor knows best. That's old school. That's how our grandmas and their grandmas viewed medicine. But now a lot of us are giving birth in hospitals when we're not sick, and we want to be empowered and we want to know what's going on and we want to make decisions for our families. But how do you make a decision if you don't know all the answers? You're not a doctor, you're not a midwife. Well, you don't have to be. Backstory. I'm Mandy and I'm playing the provider today. See? Hence these wrinkly scrubs. Backstory. I'm in the hospital. I got admitted. I'm 4 centimeters and my provider, that one, rechecked me 3 hours later and I'm still 4 centimeters. This happens all the time. Very, very common to be admitted in early labor and then it takes a really long time to dilate. So that's where I'm at right now. And I haven't changed. So my provider came in and wants to discuss breaking my water, and I have to now decide, is that what I want? I don't know how I feel. I wanted to just be in labor. So now I'm in a pickle. So here we go. Yeah, so I've offered Mandy to break her water. Her cervix hasn't changed and she's still 4. So let's get things moving. Yeah, I want to know, what are the benefits to breaking my water now? Yeah, that's a great question. So what are the benefits of breaking water? Well, it could get things going. If you've had a baby before, then quite possibly it will augment labor. That is the goal. And it could put the head of the baby onto your cervix, which can be firm and hard compared to a balloon or a bag of water. So you have a hard head helping to open your cervix and helping to thin your cervix. The breaking of the bag releases oxytocin, natural hormone in your body, so that you get a rush of that and hopefully more contractions, stronger contractions that are closer together. Okay, cool. What are the risks? Could anything bad happen? Sure. Okay, what are the risks? So it possibly couldn't work or won't work. I don't know. If you're a first-time mom and you've never given birth before, then it is less likely to work on its own than if it's used with Pitocin or if it's on someone who has had a baby already. If you've had a baby already, it's more likely to progress labor and get things moving. But again, when we say faster, we don't really know what it would have been. So we don't know if it is faster than without breaking your water. But we're hoping that it would be faster than the rate that it's going now. But we don't know, and it may not work. We may break your water and you don't dilate. Eventually you'll dilate, I'm sure, but maybe not immediately. Another risk is it will hurt more, most likely. At some point, whether it's immediate or in a few minutes or in an hour, these contractions are going to get more intense. Even if they don't dilate your cervix right away, there is a head on the cervix instead of that balloon, so they are going to get more uncomfortable. The barrier to the baby, or one of the barriers to the baby, is now broken or open. So the baby has more of a risk for infection. It's still low, and that's something to talk to your provider about at the time, what the risks are in your specific situation. But there is that chance. There's also a risk that the umbilical cord could be born first, and that would be an emergency. That's very uncommon, but again, one of the risks to talk to your provider about, and depending on your specific situation. Also, if it doesn't speed up your labor or your labor doesn't progress because that barrier is broken to the baby, as your provider, I'm gonna kind of want that baby to be coming out. Like, there's a time frame now. There's not necessarily specific at this hour your baby has to be born, but I may offer some alternatives because I want things to be moving forward. I don't want us to wait 2 more days and risk an infection to your baby. So my next question is, what are the alternatives? Do I have to have my water broken, or can we do something else? Yeah, alternatives, sure. That's a great question. Alternatives to breaking your water is don't break your water. We don't have to. There's not an emergency going on right now in this make-believe situation. There's not an emergency, so we don't have to. It's just an option. You could continue to labor on your own. You could continue to stay upright, change positions, try a peanut ball, rest, have a snack, get hydrated. There's a lot of options as alternatives to try to keep labor going or to get it going. If you have to keep labor going, as in you're in an induction, then trying those first is a great alternative to breaking water. You could, if you're concerned about the pain or the discomfort, you could get an epidural first. So that means waiting. You could wait to break your water and get an epidural or get some pain relief on board and then try to break your water. It doesn't, like we talked about, it doesn't hurt to break water. It's an exam, an internal exam by your provider. The membranes don't have nerve endings, so it doesn't hurt to break your water, but then after your water is broken, that can increase your discomfort. So some women say, oh, I want an epidural first. Can we wait? We wait, get an epidural, and then maybe it's something that you want to pursue. Okay, cool. I've been doing a lot of those things already, but some of those were really great ideas. I feel like, so the next letter is, what is my intuition? What is your intuition? I can't answer that. I still want you to tell me. Yeah. Kind of. I don't know the right answer, but my intuition or my gut is telling me to wait a little bit. You guys could talk together. Okay. Not you and the baby, you and your partner or your team. Okay, so do I have to decide now, or can I decide in a little bit? Another great question. No, in our situation right now, there is no emergency. You don't have to decide now. There's no time frame right now. You've got time, and you can make this decision whenever you want. If you want to wait and talk about it, then that's a great decision right now. I want you to have all of the information and feel comfortable, and then you guys decide and tell me what you want to do. Thank you. That felt good. How did that feel to you? That was fun. Good job, patient. Yeah, I hope that helps you practice the brain technique. I encourage you to practice it with your provider ASAP, even with little decisions like, should I get an ultrasound or have a vaginal exam in the office? This is a great way to get your questions answered and feel like you are actually making a decision instead of saying no or just going with what your provider says everyone else does. Getting more information, it's really kind of tough to do sometimes, but it's important practice. So I hope this gives you another tool in your toolbox to help you with that. When you try, comment down below if you've ever done this in your life outside of the medical field. Comment down below, because this is a real life skill that you can use anytime, and that's what the video was in our last lesson. If you're interested in more and you want that previous lesson and you want all the lessons on the ultimate guide to taking control of your childbirth, it's online right now. Down below, I've put the link. Click there, go get all the information. You can even have a one-on-one with me, answering questions and getting all of your labor positions checked out, making sure you're using the right ball, the right way, and I would love to meet you. That would be so cool. Comment some questions down below. Thank you so much if this helped for the likes. Share with a prego friend, and I'll see you next week for lesson 6. Hi, I'm Mandy, the patient. Oh wait, I can talk like myself. That was fun. Yeah, it was fun. What are you doing drinking my coffee? We have the same mug.